public board meeting is a mandatory requirement outlined in the second schedule, clause 12 of the SWRHA Act, which requires the Regional Health Authority to hold an annual public meeting to review the authority's performance in the preceding year and share its goals and targets for the current year. In alignment with our strategic plan, Transformation for Excellence 2020 to 2023, I am pleased to provide for your consideration several significant undertakings which no doubt redound to improve patient services. Re-engineered the surgical services to include a fully automated surgical waiting list management system and strengthened the pre-OP assessment clinic, which reduced the number of surgery cancellations. While significant resources were fixated on containing the pandemic, coupled with the vaccination exercises at the mass vaccination sites, health centers, and community road trips, the strategic goals enunciated for the transformation to excellence were always a priority. As a result, an average performance rating of 73% across the 6 goals were realized. Additionally, institutional strengthening activities accrued to 50% completion, whilst the average quality compliance was 90%. It is with this in mind, the board in 2022-2023 is looking forward to the following priorities being addressed, since they are aligned to the achievement of 6 strategic goals and will positively impact on both patients and staff. And these are our projections. 1, improving the workflow coordination and accelerating specialty skills training of nursing staff in the emergency department to improve care delivery. A full rollout of the CARE program, establishment of the health promotion unit, and the introduction of coherent health promotion strategies in support of the TT Moves initiative. Introduction of the adolescent health and men's health programs to prevent NCDs and decrease morbidity. Strengthen the home visiting program by adopting modernized approaches, including technology, to improve home health care and reduce complications. Maximize the operations of the community liaison unit to improve discharge planning, the referral system, and tracking of clinic and other defaulters. Comprehensive review and remodeling of the Department of Medicine to include the full rollout of the stroke unit. Review and expansion and reorganization of the oncology services to address current patient needs. Introduce operationalized technologies to improve cardiac, gastrointestinal, and neurological services. Improve the laboratory and radiology systems to improve timely response and support for high-risk patients, in particular, those accessing care at SWRHA. I'm on to 11, there are 13. Accelerate systems for achieving the International Baby-Friendly Accreditation Certification. 12, to reintroduce the Quality Awards Program to support continuous quality improvement initiatives and innovations and recognize staff for their contribution. And last but not least, to initiate a project of beautification of the San Fernando General Hospital campus. Ladies and gentlemen, at our October 2021 meeting, I stressed that healthcare modernization and transformation with a cohesive team was necessary to improve the SWRHA. We reiterate this commitment with the appointment of one new board member who recently joined the team, Director Ricky Barrett. I also wish to express the board's sincerest appreciation to the former Deputy Chairman, Ms. Giselle McFarlane, for playing a pivotal role in transforming our financial systems, and wish her success in her new endeavor. As a board, we continue to appreciate the unwavering support of our Minister of Health, the Honorable Terence Dialsing, and the ministry's technical team. Today's public board meeting solidifies the importance of engaging with all our stakeholders along this journey of transformation, since we rely on your feedback in order to strengthen the continuum of healthcare and increase public awareness on issues affecting the local southern community.
Noting strategic goal number 1, the first of the 6 pillars, which is to improve the patient-client experience and outcomes throughout the SWRHA, including secondary, tertiary clinical care excellence. First picture indicates that the SWRHA has made improvements to wait times in the emergency department, San Fernando General Hospital specifically, for patient admission times to an inpatient unit. For the period under review, 96% of patients who were admitted were warded within 24 hours. It also shows the remote filling of prescriptions and the extension of pharmacy hours continued during the period to accommodate patient convenience, whilst the last image shows and depicts that the patient's accessibility to healthcare services were inevitably affected by the pandemic, which resulted in 57,117 telehealth consultations being conducted in order to maintain the follow-up of patients for the period under review. Patient experience remained a priority, even when face-to-face contact was not possible, especially in the outpatient and primary healthcare clinics. Undeniably, COVID-19 impacted our service delivery. For some months, non-urgent services, for example, elective surgeries, were curtailed to respond to increasing pressures on acute services. This decision, while necessary, impacted several of our clients and resulted in an unavoidable inconvenience. However, these difficult decisions allowed the health system to provide critical care to an increasing number of confirmed COVID-19 positive patients and reduce the risk of the capacity being exceeded. As we reimagined and re-engineered to improve our overall delivery of care, we implemented new pathways of care for COVID-19 and non-COVID-19 related services. We increased hospital capacity, we resourced community services, we adopted technology at an exceptional rate. Although this was all catalyzed by COVID-19, these changes are aligned with our long-term strategic direction. Reporting on strategic goal number 2, decreasing clinical and corporate risk throughout the SWRHA by improved governance. We are pleased to report that the past year highlighted the importance of fast, decisive action in responding to the pandemic, while still doing all in our power to mitigate risk to our patients, staff, and the general public. During the period under review, work continued to further enhance governance arrangements, and the established executive-level oversight committees began implementation of key transformational programs, projects related to the operating theaters, committees that dealt with issues of cost savings to the authority, patient safety, business communication, and human resources. Reporting on strategic goal number 3, which is to improve primary health care, including mental health, the SWRHA's primary care network acts for us as the proverbial front door or first point of contact to our health services. The vast majority of patients' concerns are managed at this level by our primary care teams at our 34 primary care sites within the community setting. Our services include disease prevention and health education, which incorporates screening with preventative measures, community health services, including non-communicable disease clinics, antenatal and postnatal care, child health and school health services, integrated specialist programs in primary care, bringing services traditionally offered only at hospital even closer to patients. And 4, a series of allied health services. During the period under review, the primary care teams worked closely with the wider healthcare system to mitigate and limit the spread of COVID-19 using evidence-based strategies, disease surveillance, and health intelligence. All primary care services continue to be offered in a modified format, ensuring the safety of both our patients and our staff. The pandemic reduced the number of traditional home visits conducted. Notwithstanding, a re-engineered community home visiting program was initiated during this period, utilizing a family-centric model. The quality home visiting program includes patient and family health checkups, screenings, referrals, parenting advice, guidance with navigating other programs, linking families to community resources, and additional supportive services as needed. The science showed that the risk for severe illness with COVID-19 increased with age, with older adults at higher risk. Responding proactively to protect our elderly population, the SWRHA during this period also implemented the Golden Experience Initiative to vaccinate persons 65 years and over. Also to report to you, the Global Hearts Initiative expanded, albeit at a slower pace. This initiative involves the collective adoption and implementation of evidence-based interventions and practices towards the prevention and control of cardiovascular diseases, which including heart attacks and strokes, amongst the world's leading causes of death. The HEARTS model focuses on improving clinical preventive services and cardiovascular risk management in primary healthcare. Following from the launch of this program at the Freeport Health Center, training of the clinical staff on the prevention and control of these diseases continued throughout the fiscal period under review. A core health promotion team was also formed to operationalize the work of the Health Promotion Committee. This team also supported the vaccination efforts throughout the SWRHA. The SWRHA's health and wellness education program, as depicted, was maintained through our monthly presence on the WAC 90.1 FM radio station. Health topics included infection prevention and control at work and at home, COVID-19 and breastfeeding, smoking cessation, managing mental health, safety in the workplace, and disaster preparedness. The culinary food park hydroponic system, as shown, is indeed the first of its kind in a public health institution in the country. And this was launched at the San Fernando General Hospital, and this project was actually selected as a finalist for the President's IDB Award in 2021. Lands at the New Horizons facility in Peparo were prepared for further expansion of this program. This health promotion initiative at our own facility, the New Horizons facility, supports sustainable food production that links agriculture, food nutrition, and health outcomes. It allows us to demonstrate our care for our patients' health in accessing organic food, our compassion in teaching them about healthy eating practices and methods to grow their own foods, and demonstrates our competence as an authority in service to the people. Expanding a little bit more on this initiative, we would like to report that for the period, based on those initiatives, the produce harvested during this period, which included 58 pounds of sweet potatoes, 90 pounds of tomatoes, 147 pounds of pak choy, 196 pounds of chive, and 253 pounds of lettuce, with a total retail value of $9,821.50. The Culinary Medicine Food Park program has now been extended to the Point Fortin Hospital and includes pumpkin, cucumbers, okra, corn, and additional green leafy produce. Still within strategic goal number 3, the mental health program will now be highlighted. The SWRHA recognized that the COVID-19 pandemic amplified mental health issues for many and at the same time introduce barriers to accessing services. In response, COVID-19 psychosocial support and mental health interventions were provided utilizing virtual and telehealth media for patients in parallel healthcare facilities, as well as individuals who were quarantined at home, the general public, and even for our own staff. The mental health professionals provided care, counseling, and treatment for patients, which amounted to over 5,000 clinic visits. As we now report on achievements for the period under strategic goal number 4, which is to improve health, safety, and the environment, and staff satisfaction. During the year under review, the SWRHA continued to implement safety action plans. Comprehensive safety checklists were generated, and risk-based assessments were conducted. Evacuation plans were developed for 11 health facilities under review. Measures were further enacted to ensure proper COVID-19 screenings and protocols, and utilization of personal protective equipment were conducted. Additionally, strict visitation protocols were embedded to reduce risk to patients and staff. Staff education that was related to personal protective equipment, COVID-19, and hand hygiene and overall emergency planning were continuously conducted. There were significant human resource achievements to be noted under the strategic pillar that speaks of staff satisfaction, whereby over 542 temporary staff from COVID-19 facilities were offered one-year contracts with gratuity and sick leave benefits for the period. During the period, we also rebranded our internal employee solutions desk to log internal complaints, and we were also able to settle in the period, in the midst of the pandemic, issues of award of arrears of increments to all eligible permanent employees. As we now report on strategic goal number 5, reducing wastage and improving efficiency. Throughout the fiscal period, the SWRHA continued to manage its financial resources in line with good practice and all relevant governance requirements. Resource mobilization strategies were employed to optimize and maximize the use of in-house resources to complete COVID-19 related projects, thus reducing the need for outsourcing, as shown in the front row of pictures before and after. In order to maintain safe, high-quality care throughout the pandemic, special focus was placed on human resource management. During the year under review, we strategically redeployed resources to areas of critical need, such as our emergency departments and intensive care units, as well as COVID-19 testing capacity within the community, in order to address the increased demand to care for patients with COVID-19. The acquisition of the liquid oxygen reservoirs for the Augustus Long Hospital and rental of same for the area hospital Point Fortin was quite significant, as this resulted in cost savings, quality patient care, and oxygen security during the pandemic. Within the strategic goal, the bar graph illustrates that for this fiscal year, the SWRHA expended $1.23 billion to deliver these quality services to the public. Personal emoluments, inclusive of salaries and staff benefits, amounted to approximately $931 million, whilst the goods and services component of our subvention amounted to approximately $217 million. COVID expenses during this period amounted to $86,988,335.94. The red bars indicate the expenses incurred at the non-COVID-19 facilities, while the blue bars show the expenditure for the COVID-19 facilities. During this period, the SWRHA had an overall deficit of $97,152,611. Focusing more on expenditure during the fiscal period under review, the funds requested for the authority under the Capital Public Sector Investment Program amounted to $52,140,817.75. The SWRHA demonstrated a 100% spend rate of our allocation on medical equipment upgrades, hospital refurbishment, and physical investments. Continuous improvement leads to quality care, and improve outcomes and experiences for our patients and clients. Given our fiscal reality, it is imperative for healthcare to focus on value for money and efficiency to ensure sustainability of our services. Reporting on the last of our strategic goals, which is to adopt information, communication, and technology as a critical success factor, efficiency improvements were made in the SWRHA Health Information System. In 2020 to 2021 period, planning began to identify the functional and technical requirements needed for the automation of the patient health records in the emergency department of the San Fernando General Hospital. Though it is outside this reporting period, I'm pleased to report to you that from March to June the 30th of this year, 2022, outside the period, 34,352 patient encounters were entered using the automated system. As a critical success factor, ICT achievements have served as a foundation for transformation at the SWRHA. Other key accomplishments include the operationalization of the new Point 14 Hospital, the operationalization and expansion of the COVID-19 facilities, software upgrades, rebuilding of the new SWRHA website, COVID-19 electronic database to track patients' appointments, virtual public board meetings that occurred for the last 2 years, including the fiscal year under review at the SWRHA, establishing telemental health, Ministry of Health SALMI pharmaceutical inventory application rollout at selected sites in the SWRHA, and enabling of the regional transition to virtual meetings, all occurred during this period. The pandemic response has transformed our technological architecture, which will have long-term benefits to the authority and, by extension, public and clients that we serve. It has highlighted some areas of innovation with delivering care using virtual means. These learnings will be further explored to support future innovation in delivering healthcare services to you.
The SWRHA is pleased to announce the launch of its Quality Awards program, and I am here to present an overview of the program. At the SWRHA, we promote care, compassion, and competence, and we believe that the Quality Awards program allows us to demonstrate this commitment. This program is mirrored from the Ministry of Health National Health Sector Quality Awards program, introduced in 2003. We have tailored the award to allow us to address the areas of deepest concern of our valued clients. Therefore, the objectives of the Quality Awards are to 1, allow the SWRHA to further inculcate our core values, 2, facilitate improvements in our service delivery, 3, enhance the customer experience, 4, promote the adoption of best practice, 5, allows for innovation and benchmarking, 6, foster teamwork and team spirit, 7, allow us to motivate, recognize, and reward our staff, and 8, strengthen our external partnerships.